I'm Jerry Block, medical doctor here in Tulsa. I've been practicing for almost 50 years. One of the biggest problems that I have to deal with is folks who have disease due to modern civilization. Man was not meant to eat grain. There was no grain in the Garden of Eden. In evolution, man had no grain. He was a gatherer or a hunter. Grain has fed the masses, and during famines, it kept human beings alive. But now, in the land of plenty, what used to be a blessing is now a curse. And folks that have gluten intolerance are mostly self-diagnosed. Many times they go to physicians who feel that it's a rare disease. They send them off to a gastroenterologist, and there they make the diagnosis by looking down the small intestine and see that the villi glands are flat. But this is the nth stage of gluten intolerance, way before this. And in fact, for most people, if they look down there, things may look normal. But despite that, they have gluten intolerance. My colleague, Dr. Jack Wise, and I have been interested in gluten ever since I met him, which was almost 14 years ago. In fact, we conducted a study. A trial of almost 150 patients were done with Dr. Wise using natural materials to treat people that had gluten problems. He showed me patient after patient whose symptoms just vanished. We therefore undertook a double-blind study. In November 2008, for 12 months thereafter, we enlisted 27 patients. In the double-blind study, half of these were given the active ingredients and the other half were given an identical pill, but it was placebo. And 100% of patients that had the active ingredient, they were improved clinically and their lab values also improved. If an individual feels they do have gluten intolerance, it would be nice for their health professional to review their case, give their blessings. However, it's not their health professional, their physician that's going to suffer, it's them. And there is help. One doesn't need a doctor to find out if they have gluten problems. It's a trial and error method. That is, if they stay away from gluten for a whole month and they get better, it may be that they have gluten intolerance. On the other hand, there is a product that's available without a prescription, and this is the very same product we used in our double-blind study and found it very, very effective. In fact, so effective that many people, when they took the product, were able to consume gluten throughout and had no problems. In our prototype, we've treated patients who were pregnant, those that were lactating, those that had other diseases, and there's absolutely no adverse effects.